Now, the US President Donald Trump and others have touted a drug used to treat malaria as a potential game changer in the fight against Covid-19. But two new studies published today suggested that treating Covid-19 patients with hydroxychloroquine has no positive effects and could, in fact, do more harm than good. A little earlier on, I spoke to hospital physician and professor at Paris-Descartes University, Jean-Jacques Zambrowski. Here's what he told me.
This has been quite a controversy about this drug, and some results seem to be positive and enthusiastic, and some others, like the one that was just published by a French and Chinese team, seems to be more negative, or at least well, the controversy is not finished yet, because you have then to compare all the protocols when in the course of the disease the drug was administered, what dosage did it. So we need some more studies, but fortunately some more teams around the world are trying hydroxychloroquine, and with or without the azithromycin, the antibiotic that was given jointly. And so we'll probably have results whether that was the miracle drug or nothing at all.
Yeah, some are saying perhaps this drug could do more harm than good. Does that seem to be your understanding?
Well, it happens that hydroxychloroquine is not used for malaria, but it's used for rheumatoid arthritis and lupus, which are diseases I am used to treat for many, many years. And of course, it's not an innocent drug. It can have some very severe side effect in the eye, in the heart, and in other organs. But yet, at the dosage used and for the duration used in the COVID crisis, there was little danger. However, it certainly cannot be used in an unprepared patient by an unprepared doctor. So people are right to be cautious and to certainly not believe, as I said, that was a kind of a miracle drug. It is not a miracle drug, yet it might be efficient if the further investigation would provide some evidence about the efficacy. But we still must wait. There are some positive results. The latest are negative, but it's not the end of the story. We're going to hear a little more in the couple of weeks ahead of us and see whether it was appropriate or nothing at all.
What have we learned about COVID-19 during the course of these last few months in terms of what treatments work well for it, or indeed any other characteristics of this virus?
There are still many things we don't know about this virus. For example, we don't know if this virus is going to have mutations, and if the vaccine that so many teams around the world are trying to produce will still be active for the version of the virus which might come next year. We don't know if the immunity, which is confirmed by the current COVID-19, will last long, if it will be protecting us about the fact that the virus might come back, changed or unchanged. For example, the flu virus changes so much that the vaccine has to be changed and adapted every year and will not last more than 1 year. But rubella, for example, once you have had it, you never have it again. So immunity conferred by the COVID-19 virus is not yet something we know. We don't know if any treatment at the early stage is active. We don't know yet if the plasma, which can be transfused from one patient who has had the virus and recovered from the virus, can be injected with a good result to a patient suffering from the infection. The trials are ongoing, and we don't have the result yet. We don't know yet the result of those studies concerning tocilizumab, which is a monoclonal antibody, reinforcing the immunity. There are still many things that we don't know. We must be very modest and very humble as far as this infection is concerned, and in between try and keep the hygienic measures that all the government, except one or two around the world, have been taking to prevent us from catching the disease, which is the most important.
And just lastly, I mean, a lot of speculation about the massive disparity in the mortality rate between different countries. Also, some speculation that certain ethnicities are worse affected than others. Do you have any explanation for that? Do you believe it's genetic, or that a blood group, for example, could be a factor in this?
It might well be, but it might be the contrary as well, because all the countries, let's say, for example, France and Germany, would not count exactly the same way. So it's true that Germany did not take the same measures at the beginning of the study, but it's true also that they do not calculate, they do not sum up all of the data that we do in France, and I don't know about the figures in Africa or in the United States. So it's quite difficult to make sure that we are talking about the same thing. Again, we need time. Unfortunately, the disease goes fast and kills many people all around the world. But for the moment, it's very approximative, very, very much too early to have a final definition, final figures, final statistics. There are a lot of political assumptions, political influence on the figures that the different governments are providing to the rest of the world. So we have to take this at a certain distance before we say that whether you are a Caucasian, an Afro-American, an African, etc., or an Asiatic, no. In France, it's against the law to quote the ethnicity of the people. So we won't have any ethnic statistics among the people who suffered from the COVID, for example, unlike in the United States, where ethnicity is part of the identity of the people. So it's very, very difficult to make comparison here. We wait before we see.
And that was Professor Jean-Jacques Zambrowski at the Paris-Descartes University speaking to me a little earlier on. Now, as governments around the world